Ray Hague, Veteran Services.
Christian McCloskey, Youth Services.
We got everybody.
So
we're all around.
Okay.
All right, okay, well, that's all right.
Okay, and I'm Dave Weed. I'm part of the reason you're here, along with my comrades from Partners. But we're going to take about 10 minutes, do a brief presentation to go through kind of an overview. And that's part of the reason for this meeting, is to make sure that people have a good understanding of what Partners is and what we do, okay, and how we get it done. And then we'll open it up for questions, and I know some of you need to go by 3:30.
Thank you all for being here today. Like Dave said, we just want to inform you all how we have community partnerships in the city to improve the health and well-being of our residents. Partners has a number of organizations through the Chenal 25 in the health and human service field, as well as government agencies that also partner with us. We are a 501c3 and a nonprofit organization that we receive most of our funding from the Determination of Needs funds through our local hospitals, which we're so grateful for. By having these funds, we were able to employ 4 full-time employees and 2 part-time employees to help carry out the mission of Partners for a Healthier Community. There isn't one particular office or place for Partners for a Healthier Community. We're lucky to have office space donated through United Neighbors. We have staff that's there. We have staff here in the Government Center building, as well as in Fall River Recreation. Some of the employees housed there, as well as the Fall River School Department. So I am going to turn this over to Dave Weed so he can briefly explain the principles by which we operate and the health challenges that we're all working on collaboratively in our community. Dave?
Thanks, Lisa. Our principles are based on the same principles that the World Health Organization uses, that defines health very broadly. As you can see, it includes all these factors: community participation, health care services, which is a piece of it, but also safe, nonviolent environments, housing, educational opportunities, recreation, healthy workplaces, and accessible transportation, which is why you're here, Bill, because this is all part of creating a healthy community, and that we know that people cannot be healthy in an unhealthy environment. And we'll talk about that in a minute. You're probably already familiar with the fact that we have many challenges, including poverty, education, housing, substance abuse, a number of chronic illnesses, and the typical causes of those in terms of nutrition, poor nutrition, and lack of physical exercise. All of that should be familiar to everybody in this room already. So what can we do to change all that? Many people think all we need to do is improve access to health care. Send everybody to a doctor and everything's fine, right? But we know that that's not how things work. Well, we should educate the population, make sure that everybody knows how to live a healthy life. Well, we've been doing that for years, and not everybody lives a healthy life. We should improve the environment, make places accessible for walking, more parks, recreation opportunities of that sort, and access to better food and all of that. That's certainly important, but not the whole story. We should change laws and regulations. We're all familiar with the work that Maryland Edge does in terms of tobacco control, and yet we know that we still have one of the highest tobacco rates in the state here. So regulation alone is not the answer. And finally, we can look at engaging everyone in making changes, and we think that's the most powerful tool. Not that we don't want to do all of these things, but the more people get involved in making changes themselves, either within their own family, their own organization, or people who want to engage the entire community, that's the way we can make progress. We start every 5 years with a brand new health assessment. That assessment enables us to understand in great detail the kinds of challenges that we have. We've even put together our own website, Health Data South Coast. You can visit anytime, and you'll find the latest data relative to Fall River. But we include in our surveys not only the information we get from St. Anne's with Tracy and with South Coast Hospital, but also the YRVS in the schools, and surveys that we conduct with people. We do a number of interviews with people. Many of those, 30 of them in fact, are online on our website. Those are interviews from everybody from Dr. Akuri, who's in the ER at St. Anne's, and his perspective, to moms at over here Lisa's WIC program. So you've got a good sense of what the health challenges are in the community. We then use that information to develop a plan every 5 years, and we go by the World Population Health Institute and the Robert Wood Johnson Foundation, the largest philanthropic organization in the world devoted exclusively to improving health. We'll tell you more about that in a minute, but they use these 8 categories. That's a way of simply dividing up all the different aspects of health that we need to address. We have put together 62 specific objectives. Those are on our website. First thing, if you go to healthycityfallriver.org, the second menu item down is our objectives, and you can take a look at every one of those. Those are in great detail. A lot of work went into that, and we review those annually and record the progress that we're making with those. One of the things that really brought this city into national prominence, and I don't know how many people are aware, but Fall River was chosen as one of the 6 winners of the first Culture of Health Prize given by the Robert Wood Johnson Foundation. Although they're based in Princeton, they solicited over 200 applications from around the country. And Fall River was included, awarded one of those 6 first prizes. That included cities like New Orleans and Minneapolis. So we were right up there. Cambridge was another one. And then more recently, since they do this every year, we are now among 6 in the Northeast, and you see the list up there. 4 of whom are in Massachusetts now, 3 in addition to us. So we are organizing our first Northeast convention for all of those groups on April 7th. Wendy and I are working on pulling that together, but as a way of exchanging the resources and knowledge that come from the best cities in America, not the healthiest, but the ones who have the best demonstrated work in terms of addressing the health concerns that they have. So we're very proud of that award, and we get probably more recognition outside of Fall River for that than we do here. Not many people pay attention to that. So very quickly, the work we do is all collaborative, okay? And I'll just go through some very quick slides. And we work on tobacco issues, and you're familiar with the work that Marilyn and Dr. Vaillancourt do. We collaborate on drug and alcohol, and Mike Aguiar, are you in one of those pictures? You should be. At least the kids you were working with are. Right.
I think I saw the mayor in the last one, didn't I?
Well, I was going to put
As a
your
youth.
picture in.
Yeah.
Right.
No,
Yeah, there you are,
Yeah.
on the left,
Yeah.
because you had a lot to do with the tobacco law changes
You were
there.
another one too.
Yeah, I think
Right.
the one beforehand, you went
Yeah.
as a kid, right.
As a younger person, I wouldn't call him a kid. And we work on youth violence. We have an annual violence prevention effort that goes on every year, piece by piece. And Wendy's largely responsible for organizing that. We collaborate with organizations in the community, including UMass Dartmouth School of Nursing, the Health First Dental Clinic. We work with Wiggle Kids and all kinds of organizations around here to bring resources to the families who are housed, the homeless families who are housed in motels in Swansea, Somerset, and now into Fall River. Do a lot of work with that and have a full-time person devoted to that. We collaborate to support walking and biking, and many of you have met recently with Julie Kelly and Eric, right? And you'll have more meetings, and there's a meeting for groundwork coming up, and a number of things. But and certainly, Bill, you've been involved with this right along, and this is about making sure that people have alternative transportation other than automobile. and making that easier for people. Marcia's been working with the schools. We're the only school system in the Commonwealth to have had 3 years of 100% participation in walk to school programs. We have 2 schools that do a daily walk to school, safe routes to school program, and we have a number of trainings and things of that sort. And how many thousand kids have been involved?
36,000.
Okay,
That's a lot.
that's a lot. You've probably heard something about the fitness challenge. That's us, guys. I know everybody thinks it's recreation. No, it's partners. We pay the person who organizes it, Anne Marie Holly, and we're now in our 9th year. The longest running community-based fitness challenge in America, okay? Somerset's on our tail. They've done 6 years. We're in nine years. But that's been a fabulous program. It's still going very strong, and we got a lot of participation. And again, Marcia involves how many school students this year?
We've got over 5,000 students who are participating
Right.
in the Great Falls area.
Who do their own challenge within the schools, separate and above gym classes, or sorry, not physical education classes. Boy, I'm gonna get slapped for that one. We don't have gym classes,
Gym
we
is
have
a
physical
building, it's not
education.
a subject.
Actually, health and physical education. Another project that we've been working on very strongly over the last 3 or 4 years is education about sugar and making sure that kids and families understand. I see Christian smiling over there. This must be one of your favorite topics there.
Absolutely.
It's also Peter McCarthy with the whipped cream on his face, because we go out to Camp Welch and do all kinds of programs and have a lot of fun with kids there. And the nice thing is that kids and families are getting it. We've seen a big turnaround. People don't buy soda anymore, and now we're telling them fruit juice, as Rose Kudo there from St. Anne's Hospital instead of holding up a glass of orange juice, which has just as much sugar as Christian's favorite drink. We collaborate on environmental change. Again, Eric and Julie have been working on this with Bill, but all the kinds of changes, everything, from the stairwell gallery, etc. And now in the lower left, the new Quokasham River Rail Trail, which is going to become a signature project for this city. And all kinds of work, you've been talking with Julie about that, is underway. And just
That's
really,
exciting.
really going to change the
Really,
face of
really
the
is,
city.
yeah.
And we collaborate on worksite wellness. We have a full-time person who couldn't be with us here today, Angie Braz, who works not only in Fall River but across the South Coast on communities, employers, both public and private, who want to improve worksite wellness. And so you can go to the Worksite Wellness Collaborative webpage, which partners also underwrites and supports. I don't think there's another collaborative like that anywhere in the Commonwealth, quite frankly. And finally, we collaborate with medical care providers, and we all think, medical providers are always working on health promotion and health prevention. Well, guess what? In the 7-minute appointments, there isn't time for that. So we look at other resources and ways to connect patients with the resources that we have in the community. We do all kinds of things like farmers markets with tokens, and you give out vouchers for vegetables at the markets, etc. We also have 2 major projects. The one that you're working on now with Eric is the $1.72 million Mass in Motion so-called 1422 grant, and then STAR, which started, I think, 2 years ago. Is that right, Mike, with the health integration, the HIT project?
Oh, it was longer than that.
Okay, it goes for 5 years though. So
Yeah.
I think they might be in year 3 or 4, somewhere along the line. But that's to get behavioral health plans connected with health and physical health improvements.
I think the last year is this year, though.
Oh, is it? Really?
Yeah.
Okay. So our priorities, you can see them there, and we can, you can go through the list of 62, but primarily tobacco and substance abuse, youth violence, etc., school health, healthy food. Those are the things we're working on. And to conclude, what do we expect from this effort? A continuing improvement, lower crime rate, better parks, cleaner streets, improved education, healthier children, and more productive employees. Anybody against any of those things? Okay. And also a change in the image of Fall River toward a more positive point of view and a higher quality of life. And that real evidence that health behaviors are trending in a positive direction. And a sense that people are turning their lives around, which is, after all, what this effort is all about. So, let's have some discussion in the remaining minutes that we have about what you might be willing and able to help us with.
Well, David, I can just, excuse me, tell you what I'm working on with Julie Kelly. What is it that we're working on? The Complete Streets program. Sorry.
Let's jump you in the middle of choking.
The Commonwealth has a program, Complete Streets, which I believe you're familiar with.
Yep.
We talked to the mayor about it briefly, and that involves filing a commitment with Mass DOT, committing to developing a Complete Streets policy for the city. If we're successful in doing that, there's the availability of up to $50,000 in technical assistance to develop a priority of street improvements that we would undertake over a period of time. And there's also beyond that the opportunity to receive on a fiscal year basis up to $400,000 of funding to actually implement those plans. And that end of the operation similar to a Chapter 90 process. So we're going to get
Right. And that's already underway. We've identified the areas.
Julie's
Yep.
working on the priority, on the policy statement that we have to have the mayor and we're talking about that. And eventually, I believe the city council is going to have to adopt the priority as a policy. And so we're working on that, and it's right in line with the things that you're talking about, and in line with, really it spins off from the smart growth movement. And the whole idea of more compact developments, more walkable neighborhoods, more transit accessible neighborhoods, and ADA accessibility on intersections, quieter, safer, more attractive streets for all modes to use. So that's the goal.
The nice thing about those changes is we don't have to run programs or get walking groups or teach people anything. If you improve the environment in those ways, people naturally adapt to that. All you have to do is look at New York City, one of the healthiest cities in America.
That was going to be
Why? Because everybody walks. Why? Well, you pretty much have to there. And if we could create a city where walking is the preferred mode, not driving, then we can get many of the same results.
Interestingly, Manhattan is one of the greenest cities in the country, believe it or not. When you look at the efficiency of energy use in Manhattan, it blows everybody else away because it's so compact and densely developed.
Right, but they also did that by taxing on the bridges. The bridges cost between $6 and $8 to come in and out of the city.
Yeah, nobody
So-
said it was cheap.
Right, but it was a really smart move because they reduced the amount of cars coming in and out of the city by a quarter by just putting something like adding $2 to the cost of going on the bridge.
So we're putting a toll on the Bragg Bridge.
Look at Rhode Island with the trucks, right? Yeah.
So can we quote you on that, or?
Absolutely not. That was, just to clarify, that was a joke.
Madeline, we've talked with you a little bit about employee wellness, and I wonder what your thoughts are on that.
Well, I haven't had time to really get started on anything. But Kathy, do you want to elaborate on what we're thinking of doing?
The wellness
Oh,
center.
yes,
Yeah,
okay, the
for the
Wellness
Wellness
Center. This would be an extremely innovative approach to an additional dimension to our health insurance offerings within the city of Fall River. And I have to say the mayor's been a great supporter of this, and it couldn't move forward without that because the tentative location would be the Armory, Bank Street Armory.
One possible location.
Possible location, right. But nonetheless, that aside, we find a location for it. We actually have room in this building, so we have options. But additionally, what we're trying to do is to get a vendor on board to be able to provide basic medical services in a convenient, easily accessible way so that it will encourage employees to do their proactive screenings and to be able to come in and take advantage of health services without having to make a doctor's appointment, without having to incur the cost even of a copay. I mean, this is something that they've done the financial analysis and determined that there's actually a tremendous return on that kind of an investment because employees will take advantage of the services and get the kind of routine screenings, et cetera, that they really need to have. And The program is not just focused on health services, but one of the attractions, if you will, is going to be the idea that if there is a gym, either on-site or located nearby, and that there can be educational programs and yoga and all kinds of ancillary services for the employees, again, free of charge, to help them focus on developing healthier lifestyles.
And we know when that's been done in other places, it's been a money saver in
Absolutely.
that process. 'Cause every healthy employee that you retain, the less you're spending in medical costs.
And we are self-insured,
Yep.
so every time we can avoid a hospital expenditure, we save as a city.
I announced that project at our last meeting last Friday, and we have a number of people, organizations who expressed some interest in applying. So hopefully by is it the March 4th deadline?
Yep, RFPs
You'll
on the
get
street.
Right, absolutely. And we also talked about the fact that Partners is well equipped to work collaboratively with any of those clinics to make sure that people who are in those clinics are not just getting health screenings, but can engage in the fitness challenge or take a nutrition class, or their young mom get some cooking classes and things of that sort. So those are the kinds of things that we're very much interested in. Right, we also address veterans issues. We have active veterans on our steering committee, and I'm wondering if you have any thoughts about ways that we might address some of the issues that veterans present.
Well, when they come to our office, they are in for medical reasons, and if there was something available for them, I'm sure they would take advantage of it.
And you could help us get information to veterans about the different kinds of resources that we have available.
Exactly,
in the community.
and the veterans community have similar demographics that you have, so
Right.
you might be able to merge some of that together,
Yeah,
because they're
it's the
working
same
on
thing.
similar things.
Right. And they have other resources that non-veterans don't have access to.
They do.
If you can encourage them to take advantage.
They do.
That's the hard part.
Yeah.
But-
They have a lot of programs on the smoking cessation programs and
Right.
just about everything. They
Right.
have just about everything.
So one of the things we need to do a good job of is making sure that when we're talking to folks, that we ask them if they're a veteran, because they have access to those resources.
Right, and if they're not working in this program, we can pick them up in a program that we have.
Right. Other thoughts about things that we do? I don't know, Christian, you do a lot of work with youth. Anything in particular you want to say about that?
Well, everything's based on the positive youth development model, with looking to address the risk factors by increasing the protective factors. And forever, we've embraced the America's Promise. We're really focusing on those 5 promises. And then by March 9th, we're going to be submitting our application for an all-American city. It's focused on healthy youth and healthy youth development.
And I think that's a good example of the way that Partners works. If you're familiar with All America City, raise your hand if you're working on writing that application. Okay. We have a lot of Partners people involved in that. I was involved in the 1422 grant. We have our method of working is not to gain resources for our organization. Our organization is temporal. We don't have a building because we're not going to be here forever. But what we do is focus our resources on ways that we can help the city resource itself and create programs that'll be long-lasting, long after we're gone. So
I think that one of the things we talk about in Partners all the time is the collaborative effort. That if we think that when someone presents, they present with only one problem, then we're missing the boat. Someone will sit across from me and say that they need money for food, but really embedded in that is job and transportation and health concerns and things like that. So by having the power of the 40 or 50 organizations that come to the table for Partners, it enables us to really look at somebody holistically. I can't solve the plethora of problems that people come to me with, but I can turn to my community partners that are part of Partners and get them on the right path. So I think that that is one of the best things, and that is actually what Robert Wood Johnson recognized us for, and what they send us around the country. Dave and I have been sent to a number of places, Chicago and Princeton and Philadelphia, to talk about how we get people to come to the table and collaborate. And that is one of the strengths that we have here in the community.
We also have a substance abuse piece that we're working on too, with the task force, which is a subcommittee of the Chennai. And we're going through a strategic planning process now. Tracy, St. Anne's has a co-chair, Stephanie Perry is the co-chair, with Rachel from South Coast Hospital. So the two hospital folks are the chair people of task force, which is really, really a good move. I don't know how that happened, but the stars lined up and that was perfect. So there is a whole different a new process starting. It's a new year, and there are some things they're working on. One of them is getting learned to cope here. Did you get that letter out, Tracy?
I will. I've got the room
Put her on the
secured,
spot. Did you get
so-
that on tape, Dave?
Yeah.
And under that umbrella, we also have a new committee for substance abuse newborns. We have a very high rate here. Lisa and I
Yes.
sit on that
I
much
was
as well.
thinking that,
We have a very high rate of newborns when addicted here in the city. So a task force came together. That is one of the things that Partners is best at. When we see an emerging issue, because we have this power of collaboration, we can quickly put together a coalition to start addressing it. The newest endeavor that we have now is we have a brand new suicide prevention coalition task force with everyone from funeral homes represented, veterans represented, people in health and human services, people that have attempted suicide or had someone in their family commit suicide. We've had 3 meetings and we already have 30 people coming to the table. We have a community conversation planned for April that the Herald is going to sponsor. And we have a curriculum that Tracy's hospital is very generously purchasing so that we can do it in the social emotional learning groups in the schools. So within 3 months, we put this whole thing together because we had a lot of suicides. We had a little girl, 14 years old, that only named a couple of weeks ago, and we have to respond to it. So I think that that's the power that we bring through collaboration.
I think 2 things to note too. One thing, we keep mentioning CHNA. CHNA stands for Community Health Network Area. There are 27 of them statewide, but our CHNA is Partners for a Healthier Community. So CHNA sounds like it's like, what is that? What does that
Old
mean?
school.
Yeah, it
Can't
really,
get past that.
I know.
When we did our first conference,
Oh, yeah, that was
we
funny.
put signs up in the hotel that said Shana, and the hotel person came and put an I in it because she thought we
China.
misspelled it.
I think the other thing to note too is the fact that we've only got 4 full-time employees, so it has to be done in a collaborative way. But what we do, except for the fitness challenge where we charge $5 for 3 months worth of
4
twice a-
months.
for 4 months worth of twice a week activities, blah blah blah. I mean, you can't get that anywhere else. But other than that, everything we do for nothing. We don't charge anything. I mean, I work very collaboratively with the schools. Mayor Brown is very good about giving the office space at one of the schools. And as Dave mentioned earlier, we bring a lot of money into the schools. There's actually $1 million grant that we have been awarded from the State Department of Transportation, which is still in the process of going through whatever steps it needs to go through to have it materialize, but it will improve the infrastructure around the Viveiros School to make it easier to walk. We also co-wrote a grant for a $100,000 fitness center at Henry Lord. So we do a lot of these things not to be self-serving, but to serve the community.
Hey, can you share that fitness center?
I said, I mean, it's extraordinary, the equipment that's over there, and with my apologies to my colleagues who have heard me say this a million times before. I used to work for an organization that covered 72 cities and towns throughout southeastern Massachusetts, the Cape and the islands, and I always said, if I could ever work in one community, and I worked in Brockton and Attleboro and Barnstable and New Bedford, all of the big cities, if I could ever work in one, it would be Fall River. And it's because of what you just got through seeing up there. It's because, as corny as it sounds, as far as health and human services go, people play very nicely together. There is so much good, I'm gonna be on your soapbox, there is so much good stuff going on in this city that it angers me so much. I've got to stop listening to the radio. It's really, I've never called in, but I talk back to my radio in my car all the time. It's like, I was at that meeting. That's not what happened. Why did they sing it? It makes me absolutely crazy. And when people criticize,
Pick up
you know, the
that phone,
quickest
Marsha.
you know, why are they doing that? Why are they putting it to potholes? Because that money can't go for that. People don't understand. And so, yeah, I just want to talk. So I'm sorry, I'm my soapbox. But it just makes me very, very angry because there's so many good things going on in this city. And it really, really bothers me.
I've never seen you angry.
I just keep, like David's always saying, I'd like to see
That's
you
about
really
as angry
angry.
as she gets.
Yeah, that's about it.
Get a
But I
couple
mean,
of
just
darns
thought,
out of
you
it.
know the good things that are going on in this city, and yet why people think that the glass is way beyond half empty
That's okay,
is
that'll
just
change.
so frustrating.
Well,
It's just
I
really
think from our
frustrating.
perspective, you know, because of the structure we have and the limited amount of funding, we make decisions. Are we going to PR our work, or are we gonna do the work? And we decide to do the work. So that's part of it, and that's probably something that you can help us with in terms of being verbal about what we're doing and being able to talk about that with other people, because I think that they really don't know
Sure.
what's going on in the city and the kind of strides that we've made. And, you know, we get a little thing in the Herald and it lasts for, 30 seconds and then we're on to something else again. But if people really understood what was happening, they would get behind us and feel good about this.
The Robert Wood Johnson Board is a really, really big deal. When we mentioned it to New Jersey to get that, one of the gentlemen who was on the assessment committee that came here for 2 days to see the fitness challenges, to see the walk to school programs, et cetera, came over to us and he said, I'm really not supposed to say this, but of the 6, he said, you are all my favorites. So, I mean, and again, New Orleans, Minneapolis, Santa Cruz, these are big cities, and little tiny dinky Fall River.
Right, so
But,
one of
you
the,
know,
one of the
just
cities
really-
that won was being supported by Duke University.
Yeah,
So they
really,
said to me,
you
so
know.
who supports you?
Duh.
No, but I
And you saw our office.
Hit the nail on the head, right? Because when Robert Wood Johnson's people were here, they were really impressed because we all around the table said we, not I, our, not mine.
Right.
But
Mhm.
part of the problem I think we're now seeing is, right, because everyone's worked together, so much has gone on under the surface. As you said, rather than waste time trying to PRing it, we've instead roll up your sleeves and let's get it done and do it and move. And I think that's what we're sort of seeing. People don't realize what's happened when you talk about, we had our grant for municipal employee wellness from the state, and we were really trucking along. Remember with Julie on that one, where we had
Absolutely.
employees when the grant ran out who were upset because we weren't going to DPW anymore and checking cholesterols. We weren't going to the garage and doing blood pressures because there was no one to pick up that fall. So I think, the city is ripe for that step, because by the experience with the municipal employee wellness grant, quite a lot of people were taking advantage of going to the nutrition classes, going to the screenings, trying to form exercise groups. You may not, I think you still might have been a council at the time, but we had in the evening, did we do salsa dancing or some type of dancing we were doing in the atrium?
That
Right.
2 nights a week for employees who were staying and doing exercise dancing.
And the Tufts University grant that you oversaw when I was serving as the project manager here, the 2-year grant, we were one of only 3 communities in the country to get that grant. And we are the only one of the 3, well, there's one in Florida, one in Pennsylvania, and Fall River. We are the only one of the 3 that are still carrying out those
Sustainability.
projects way beyond the 2 years of the grant, because partners makes it possible to do so.
So one of the things they said to us, Robert Wood Johnson, when they came down, we did 2 days of sitting with them, community partners, and they said it was unclear to them who represented what organization. That they, every time they thought they had us pinned, oh, you're the hospital person, oh, no, you're not, you're the drug person, oh. And that is something that they've said over and over. We've gone down every year to meet the new prize winners. Now there are 20 communities. And that is what they keep on emphasizing again, this seamless connection that we've been able
The
to
we
bring
that
here.
you were just saying.
So I guess my question and my soapbox is, how do we take this great work that we're doing and how do we get it out to people? Because I'm a firm believer that people are attracted to winners. And if they perceive the work that we're doing as winning, they're going to want to be part of it. Everybody wants to be part of the good thing. So we haven't found that magic button yet to make that happen. But I think that that's one of the things that we should be looking to and talking about in a really big way.
Okay, good to know. Yeah, we'll ponder that a little bit. I don't have a specific answer at this moment off the top of my head. One of the things we're working on in the FY17 budget is creating a marketing department for the city of Fall River. And we do have to market ourselves, and we haven't done that both within the community and outside the community. And inside is just as important as outside. So this might be an avenue that makes sense for that marketing department to be undertaking. And that it may not necessarily be a city marketing department, it could be a firm that we hire. We're looking at what that process may look like. but I think that's an initial thought. Secondly, I mean, little things like the Facebook pages and the promotions we do
Social
that.
media.
I'm telling you, like, we had a video that we did about, the position that we were creating.
Yeah, bring that up.
And, it was like 12,000 views and, like, literally 12,000 views and hundreds of shares and stuff, so I think that's an important element too.
Social media is the way to go these days.
Well, it's
It's
part,
very
it's one
interesting
part.
to me that when Dave and I, we put together with our colleague out of Boston, David Aronstein, we put together statewide Chana meetings for all the different organizations. And when we walk in, you hear the buzz, oh, Full River's here, Full River's here.
That's
You know,
it.
they look at us like we're the kings, but we come here and it's like, who the heck is this? So I'd like to get the same sort of esteem and vision right here in the city that we're getting outside of the city, that our colleagues are giving us.
Well, let's work on that then.
Yeah.
Good.
I would
Well,
love to work
thank you
with
for
you on
everything
that.
you've all done. You've done it since my childhood and continue to do the work.
We
So,
talk about you all the time in Princeton.
Oh, jeez.
We're dropping your
Made me
name
blush.
in the All-America City
Jeez,
application
that
too.
made me blush.
Well, you're a great example of
Well, it's true.
of starting as a youth and moving up and bringing back positive change.
And
Well,
caring about
your
the city.
and your contemporary Jay Wan, Jessica
Mhm.
Wan, who
Same
worked
thing,
with you
yeah,
on all
same
those
thing.
things, she is now serving at United Neighbors as the
Absolutely.
AmeriCorps, giving back to the city and thinking about doing a second year actually
Yeah,
as an AmeriCorps.
that's
member.
incredible.
Don't forget the chief of staff too.
Yeah.
He was a part of all this.
That's
for
true
years.
too, I forgot about that, Chris. So,
Good.
thank you so much for your
Thank you
time.
for
We
your
really
time.
appreciate
Oh,
it.
my
Schedule,
pleasure,
thank
please.
you.
My pleasure. All right, thank you, everyone.
Thank you. Mike, you got one second for me?
What's that?
Two seconds.
Yeah.